Hi guys, it's Grace. Welcome back to another video with Trinity School of Medicine. Today I'm going to be going over frequently asked questions about rotations in California. So Trinity is going to send your name to the Genesis Medicus Clinical Campus here in California, and there you'll receive an email with all the documents that are needed to start rotation, and that includes like your vaccine records, your TB and flu shot. They're going to ask for a drug screening, a background check, your CPR certification, and you're going to complete some trainings online before you start rotations. So Genesis Medicus offers rotations in Modesto or in Los Angeles. I'm currently in the Los Angeles area. We have rotation sites in PIH Downey, PIH Whittier, Hollywood Presbyterian. We have PIH Good Samaritan in downtown LA, and we have several different clinics throughout LA. 2 to 3 weeks before you start your rotation, Genesis will send you an email with a PDF of everything that you need to know for that rotation, including the doctor's name, the address of the place, the dress code, the start date, and the time to be there, and any specific instructions that the preceptor wants, like if he wants you to dress business casual, or wear your scrubs, or even bring your own laptop. And so far with the experience that I had, Genesis is pretty good at placing you at a hospital or clinic that is not too far from where you live. So for the first Monday of your first rotation, you actually won't attend rotation. You'll go to the orientation that Genesis Medicus holds at their office in PIH Good Samaritan in Los Angeles, and there they'll be going over certain rules, if you need to take a leave of absence, if you need to take time off during rotation, dress code, and other things to expect while you're rotating. From the experience that I have had here in California, most of the rotations start at 8 a.m. and end at 5 p.m. It depends if you're in the hospital or if you're in the clinic. Sometimes if the clinic is really busy, you'll stay after 5, and sometimes if it's not, the preceptor will let you go early. For example, my internal medicine preceptor lets me know what patients I have to see for the next day, so it's really important to come early the next day to review the patient's chart before going in and talking to the patient and presenting to the preceptor. It really depends on the specialty, the preceptor, and the location that you're at, but for the most part, you're expected to know how to take a full history and to perform a physical exam and to present back to your preceptor. Some preceptors will allow you to assist in certain procedures in the clinic or in the hospital, and they sometimes will tell you to read up on a case and present it back to them the next day, or a certain topic or diagnosis that you see that day. So you have to come prepared. Well, that's all I have for you guys today. If you think I missed a question or you're interested in rotating in California and have any other questions, please drop them in the comments below and I'd be more than happy to answer them. Until then, I'll see you guys next time.